This presentation will be on caffeine addiction. What is caffeine? Caffeine is a natural stimulant. Caffeine stimulates the brain and central nervous system, which can help one stay alert and prevent the onset of tiredness. Caffeine is the most commonly psychoactive drug used in the world. It occurs naturally in over 60 plants around the world. It is used in various foods, drinks, and medications. Caffeine can be found in coffee, tea, cola, chocolate, soft drinks, energy drinks, and in many others. Caffeine addiction. Caffeine is addictive due to the way the drug affects the human brain. Structurally, caffeine closely resembles a molecule that's naturally present in our brain, which is called adenosine, as you can see in this image. Caffeine can fit neatly into the brain cell's receptors for adenosine, effectively blocking them off. Normally, the adenosine produced over time locks into these receptors and produces a feeling of tiredness. When caffeine molecules are blocking these receptors, they prevent this from occurring, thereby generating a sense of alertness and energy for a few hours. People who take advantage of this process on a daily basis, such as coffee, tea, soda, or energy drink addicts, the brain's chemistry and physical characteristics actually change over time as a result. The most notable change is that brain cells grow more adenosine receptors. This is why regular coffee drinkers build up a tolerance over time, because they have more adenosine receptors. It takes more caffeine to block a significant proportion of them and achieve the desired effect. This also explains why suddenly giving up caffeine entirely can trigger a range of whiff effects, such as feeling mentally foggy, lack of alertness, feeling fatigued, and a throbbing headache. Pharmacological considerations. Method of administration and dosage. Caffeine can be given by mouth. For headache and or improving mental alertness, it is 250 milligrams per day. For tiredness, it is 150 to 600 milligrams. For headache after epidural anesthesia, it is 300 milligrams. For preventing gallstone disease, it is 400 milligrams or more of caffeine per day. For preventing Parkinson's disease, for men, it is drinking 421 to 2,716 milligrams of total caffeine daily have the lowest risk of developing Parkinson's disease compared to other men. And for women, moderate caffeine intake, which is about 1 to 3 cups of coffee per day, work best. Caffeine can also be given through an IV, and it is usually done by healthcare providers for breathing problems in infants, headaches after epidural anesthesia, and to increase urine flow. Caffeine interactions with other drugs. There are 3 different types of interactions. There is major interactions that one should not mix with caffeine, and that is with ephedrine. It could cause too much stimulation, which could lead to serious side effects and heart problems. There are moderate interactions that one should be cautious when combining it with caffeine, and that includes antibiotics, medications for depression, estrogens, and many more. Some side effects could include jitteriness, headache, increased heart rate, high blood pressure, nervousness, and many more. And there are also minor interactions that one should be watchful when combining it with caffeine, and that includes alcohol, birth control pills, medications for diabetes, and various others. Some side effects that could occur when combining these drugs could include anxiety, insomnia, jitteriness, and other side effects. Physiological aspects: the absorption and distribution of caffeine. Caffeine is usually rapidly and completely absorbed, with 99% being absorbed within approximately 45 minutes of consumption. High volume of caffeine appears in the bloodstream approximately 1 hour after it was consumed. When it is consumed in beverages, most commonly coffee, tea, or soft drinks, caffeine is absorbed rapidly from the gastrointestinal tract and distributed throughout the body water. More rapid absorption can be achieved by chewing caffeine-containing gum or other preparations that allow absorption through the oral mucosa. Caffeine is absorbed and distributed into the bloodstream, circulatory system, and brain. The distribution volume of caffeine within the body is 0.7, which is a value suggesting that it is hydrophilic and distributes freely into the body's water. Caffeine also passes through all biological membranes and readily crosses the blood-brain barrier. Metabolism and excretion of caffeine. Because caffeine is readily reabsorbed by the renal tubules, once it is filtered, only a small percentage is excreted unchanged in the urine. Caffeine metabolism occurs primarily in the liver. The first metabolic step counts for approximately 75 to 80% of caffeine metabolism. Caffeine is cleared more quickly than paraxanthin, which is the dominant metabolite in humans, so 8 to 10 hours after caffeine ingestion, paraxanthin levels exceed caffeine levels in plasma. Formation of paraxanthin and its excretion in the urine appears to be the major pathway for caffeine metabolism. Body reactions. Here are some images showing how caffeine affects different parts of the body. Some of the effects include headaches due to consuming too much caffeine or due to caffeine withdrawal. It could cause rapid heartbeat and/or heartburn. Caffeine can also increase blood pressure and various other effects, as you can see here. Psychological aspects. Caffeine can affect the mood and expectations of the individual consuming caffeine. Caffeine increases alertness and boosts one's mood. As mentioned earlier in the presentation, one's brain naturally produces more of a molecule called adenosine from the time we wake up until the time we go to sleep. Caffeine sticks onto the receptors designed for adenosine, pushing them out of the way, which is why one is feeling more alert and awake. Caffeine could increase anxiety like many other stimulants. The effect of caffeine on mood are related to how the person expects the caffeine to make them feel and the context of the caffeine consumption. Expectancies of how caffeine will affect one's performance seems to underlie some of the improvements in performance. Caffeine can also impact the tasks the individuals must conduct. Caffeine has shown to improve different tasks one must conduct, such as vigilance, response times, and information processing. Research has shown that when comparing people who have a daily intake of caffeine up to 100 milligrams per day and those who regularly consume a lot of caffeine, more than 300 milligrams per day, the improvements are quite small and don't get better with more caffeine. In addition, when people use a lot of caffeine every day, they do show improved performance with more caffeine. However, it may be that one is simply counteracting the effects of caffeine addiction. So by more caffeine, one is getting closer to what their performance would be if they weren't addicted to caffeine in the first place. Breaking a caffeine addiction. Caffeine addiction could be broken in two different ways. One could either reduce the amount of caffeine consumed each day, or they could stop suddenly and in an abrupt manner. Withdrawing symptoms are short term. They are usually present for about 7 to 12 days without consuming any type of caffeine. During that period, one's brain will naturally decrease the number of adenosine receptors on each cell due to the lack of caffeine consumption. Without consuming any caffeine, the levels of adenosine receptors in the brain reset to their baseline levels and the addiction is broken.